My name is Brian Nelson Jones, and I am an auctioneer of antique and classic cars. I've been an author of many books and articles on that for well over 40 years. Quite a confluence of events to have the right man the first time around. I was hurt very badly in an accident up in Michigan on December 20th, 2 years ago. It'll be 2 years then. And someone ran into the back of our car sitting at a stop sign, or not a stop sign, but a stop light, going 75 miles an hour. And so I became one great big bag of broken bones and complaints and all of that. And I was referred to Dr. Farrell because this shoulder in particular was really very badly broken all the way through, and you could see from the MRIs the ligaments hanging down and the bones really a mess. This one also is a mess, but it's not as bad. And I wound up with several broken ribs, a broken nose, a broken jaw, a couple of fractured discs. So this is not exactly a fun time for anyone, and you need the best of the best. And I wound up with the best, and that's Dr. Farrell.
In the accident, he separated his shoulder, and let me take a second just to go over the anatomy of the shoulder. So this is a model of the shoulder, it's a model of the right shoulder. And the area that he injured was here around the end of the clavicle, the collarbone here. So the shoulder is made up of the scapula, the shoulder blade, which as you know sits on the back of the chest wall, the collarbone, and the top of the arm, which is the humerus. And so the clavicle, the collarbone, is stabilized on the outside part here by two sets of ligaments. The AC ligaments go from the acromion to the clavicle. So the acromion is just this flat part of your shoulder blade. The AC ligaments. And then there are two other ligaments that go from this bony prominence called the coracoid up to the clavicle. And those are called the CC ligaments. They each have a name, the conoid and the trapezoid, but they're collectively called the CC ligaments. So he had torn both sets of ligaments, the AC ligaments and the CC ligaments. And so that's a shoulder separation, and it's called it's a type 5 shoulder separation. What makes it a type 5 is when you tear both sets and the end of the collarbone punctures the fascia, which is a thick connective tissue around this muscle called the trapezius. And so when you see somebody that's had that kind of separation, it looks like the collarbone or clavicle is sticking up in the air, but really what's happening is the shoulder blade, the scapula, and the humerus are falling down. And the clavicle's in the same position, but the other structures come down. And the reason why that's such a problem is that there's nothing supporting or stabilizing the end of the clavicle. And so whenever you move your arm, that clavicle sort of windshield wipes back and forth in that soft tissue, and it's quite painful.
I've been around medical people all my life, and it's a gift in a way to find someone who first of all is very smart and very skillful, and he also cares about what he's doing. He's got a great personality. He does care about people. I'd recommend Dr. Farrell because he is that unusual combination of brains and knowledge, which may not be coextensive terms, and caring about people. And he's got the kind of positive side to him that he really is encouraging the patient as an individual. You can do this. This is going to take time. Now, we're over a year since all of this happened, and he's still just as encouraging, and he doesn't put you down if you missed something, but he'll keep encouraging you, and a lot of people need that.
The surgery for that is to stabilize the end of the clavicle, and there's lots of different ways to do that. the way we did it in his case is to reconstruct these ligaments with some allograft tissue, which is, in this case, a tendon that came from a cadaver. And there's different ways to fix it to the coracoid here. But the point is, by reconstructing these ligaments and the AC ligaments, you stabilize the end of the collarbone, and then you don't have that motion there. And it's very effective for pain relief and for improving the patient's function. And so that's the surgery that Brian had, and he's done just fantastic after that surgery. The surgery is typically an outpatient surgery. Patients are in a sling for 6 weeks after that surgery, and the reason for that is we want to support the elbow and lift up on the arm, and that takes the stress off of where the reconstruction is. We do some physical therapy during that time frame, but at the 6-week mark we come out of the elbow and we really advance things, working on shoulder range of motion and then shoulder strengthening of the rotator cuff and the muscles around the scapula, the shoulder blade. And he's done very, very well.